Welcome to the show, Food for Life, and this is your host of Saxena here. As usual, we'll be discussing on some of the lifestyle diseases here. When I mean to say lifestyle diseases, the first thing which comes to my mind is just one particular thing which is considered to be as a lifestyle disease. And yes, when I tell this is lifestyle disease, I mean to say we need to work on trying to prevent its complications because in this particular malady, what we are talking about, people know that yes, by just controlling some things, you can always can prevent some complications and all that, which is not absolutely true. We had seen, yes, I'm talking about a thing called diabetes, and yes, I'm talking about just by controlling the glucose levels is not the only answer, because we had seen people controlling sugar levels and their complications are not prevented just by controlling. Yes, it is a I this is a double-edged sword thing. I believe you need to have control the sugar, try to work on some of the other parts also. And what we need to do here when we are see is improve that insulin sensitivity, because most of the things which we have worked on is what are the diets we are trying to talk about, what are the exercise patterns we are trying to work on that. We need less of medications and supplements, and we need that dietary as well as that exercise patterns which may improve the insulin sensitivity. That should be the key, which we should be working on that. And as a doctor, I normally look into some things uh, which gives us some meaningful stuff of how your sugar levels are maintaining and on. We look into some parameter for HbA1c, which is a good marker. See, I'm not a conventional endocrinologist, but people come to me with a lot of complications with diabetes. The complications starts from gangrene of the foot. The vascular complications are in a big way, which is happening here, and people they do get with a lot of atherosclerosis, and there's a cessation of flow of blood into the lower limbs, and they start getting into a thing called intermittent claudication. Intermittent claudication is a simple thing which I would like to explain you is the people when they walk for some distance they start getting cramps in the legs. So again, it depends on person to person. If you have got a limited blood supply, if your lower blood vessels are are having some narrowings and on, there is that particular thing is causing obstruction of blood flow into the distal peripheries, and this is a sign of microangiopathy, which we normally look into that. And sometimes we have a larger blood vessels also. There is some we are able to show some obstructions and all, particularly at the popliteal or femoral arteries and all. So what I'm trying to put across is, in my practice, it's people come for hyperbaric oxygen for that non-healing ulcer which is there in the foot, and we are not able to control the diabetic this one. This There is a see, it's a vicious thing. You have a non-healing ulcer on one side, you have some infection on the other side, you have fluctuating blood sugar levels on the other side. So we are dealing with some kind of stuff where there is a impending gangrene, or there is a gangrene which is set in, or there is a surgery which is done. You have got a amputation of a small finger, but what happens is that after that process also, most of the things are not being catered. Not catered in the sense they have not been. Still, you have got that underlying process. Your sugars are fluctuating. You have some part of infection with the bone, and you have something like vascular complications are there. So I somewhere I need to get into this particular thing. So when I'm dealing with this certain kind of patients who are on the edge, who had these complications, I am trying to work on a simple thing, which is start with a hyperbaric oxygen, and we just do this in a kind of settings where we try to do 1 hour each kind of sessions for a patient. It can be 60 minutes or a 90 minutes. We try to put the patient into a chamber which has got high flow of oxygen into that, and this results in a proper kind of, it acts as a magic for some of the people, because we are trying to work on. See, you have got a limitation of blood flow into that particular part, so you have got a problem with that. I can say the logistic wise, the oxygen is not being transported in the last mile. Last mile connectivity is a problem here. So what happens because of the oxygen, the blood flow is hampered. It is not getting into that particular distal areas. Distal area means the leg, last is my the foot and all. So here we use this particular modality where hyperbaric oxygen, it improves the oxygen carrying capacity, not just in the into the with the RBCs only. It can help the oxygen carrying capacity of the venous blood also increases. Oxygen carrying capacity to the lymphatics, to the plasma. So all these things help the areas which are not healing, the areas which has got some impending gangrene or something like that, and there is no proper healing at that juncture. So just by improving that oxygen delivering into that tissues, we are helping that process of oxygenation into the distal tissues where you require oxygen is the most. So yes, this is the process we do in a big way in this part of the world, which is Hyderabad. And when I look into these cases, I have to deal with all the stuff, because I need to work on the diet part, I need to work with the infection part as well as kind of thing. Because patient has gone to the different special things, endocrinologists, they have advised some things and all that. He's not getting better. So the first thing what we try to work it, I'm talking here about diabetes. What are the other alternatives what we can do in spite of all the medications and all that? Mind you, I'm talking about less of medications and less of supplements and more of a dietary and exercise patterns to improve your insulin sensitivity. So if I am able to improve your insulin sensitivity by adequate proteins, with a high fiber in the diet, with a healthy fats, and we need to understand what is the low glycemic index of certain foods, what we are talking about. When we talk about low glycemic foods, we need to understand some of the foods what we have been present in the normal this one now. They have are very refined sugars. We have got very refined carbohydrates. The moment it gets into the stomach, there is a spike in the sugar levels, and suddenly it goes up to some high. Then slowly it comes down. So this spike in the sugar pattern, it causes insulin to overreact. There is a lot. So this is the frequency, the frequent spikes in the sugar levels, which increases the glycemic sugar levels, which is resulting into this particular problem, which is insulin resistance is one of the cause. So we need to talk about something like low GI foods, low glycemic index foods, which has which doesn't increase the sugar to certain high levels. It can increase the sugar for some time, and over a period of time it slowly tapers down. This is the very ideal scenario where we talk about. So when I talk about this diet, I would definitely like to eliminate the refined sugar from the diet. we ask the patients to reduce the starchy carbohydrates, like avoid bread, avoid rice, avoid white potatoes, and yes, I would like them to increase the healthy fats. Healthy fats are usually essential fatty acids. What they do, they talk about, and the other way of increasing the efficiency of insulin is I'm a huge fan of these resistance exercises and alternate aerobics as well as resistance exercises, where we are trying to work. I have, in fact, I have told one of my 60 plus years old person who was having a problem with some big issues and all that. I have made him took the dumbbells and all that, and he not go into the extremes, but somehow if we can improve, if we can work on this resistant exercises, it makes a big difference as such. And apart from that, I'm working on some areas like high potency multiple vitamins and mineral formulas, particularly trace minerals. The thing is, we just not talking about just iron, or but we looking into multiple things which can be into trace minerals are usually selenium. We are talking about zinc. We are talking about something like trivalent chromium. I'm not going to that chromium part, but trivalent chromium is again one of the simple minerals. They help your glucose kind of insulin resistance and all that. So the whole flux importance is optimizing glucose metabolism and insulin action, which is probably better done by a simple thing called magnesium, which is about 500 to 1000 milligrams per day, which is the desired things which has to be taken, and it can be taken orally also. But what I believe is instead of orally, transdermal magnesium is more preferred. Oral can cause some loose stools with people, and I had seen magnesium is universally deficient in all diabetics, and just by correcting the magnesium levels can help prevent the diabetic complications. This is being peer-reviewed journals. It has been already shown this particular stuff. And the other mineral which comes to my mind is something called zinc. Zinc should be given in the form of 30 to 60 milligrams per day, and it improves insulin action. It and The levels are very easy to monitor. It is by the zinc taste test. Zinc test is if it is over, the person goes into some kind of metallic taste in the mouth. So we know that the moment the metallic taste is there, and we know this is a problem with the zinc is over. So we need to reduce this particular thing. Normally we use something like zinc picolinate and all that, and I must tell you about the other trace mineral which strongly feel will help in the glucose metabolism and insulin action is that chromium, which is into 200 to 1000 micrograms per day dosage, and it is in the form of as chromium aspartate or picolinate or polynicotinide forms. It helps the blood sugar levels by improving the cell sensitivity to the insulin. So this is one of the very important stuffs. Another one which comes to my mind is something called vanadium. Vanadium is the dosage is about 7.5 milligrams to 25 milligrams, and it is also known to cause the mimic the action of insulin, and thereby lowering the blood glucose levels. Uh, Coming to the from trace minerals to the vitamins and all, I would certainly like to start with my thing. It's a very simple stuff which is called vitamin E. We normally it's called tocopherols, and we normally give 400 to 800 international units per day. It not only it is a good antioxidant, it not only helps prevent blood vessels, but improves the glucose metabolism and insulin action. Um, it is a very good antioxidant. The second vitamin which I would like to suggest for any diabetic is something called biotin. This B vitamin enhances blood insulin sensitivity, and that's therefore reduces the blood sugar levels directly. And see, we had strong reasons about biotin. High dose biotin, it helps in the patients who have got retinopathy, and you are interested in strong hair and nails, you should always take high dose biotin. It helps in the texture of the hair also improves. The few other things about when we go with the same this one, I would like to work on a thing called Gymnema sylvester, which is a herb basically, and it promotes repair of insulin producing cells of the pancreas. Uh, it promote repair of insulin producing cells of pancreas. It's a huge thing. Because what happens is that we are talking about mitochondrial cytopathy. We are talking about something like the beta cells of pancreas, which are getting slowly degenerated. When I mean the term by degeneration, I somewhere have to tell that when we are looking at the cells in the degeneration of the ray kind of thing, we talk about having something. It makes it is slightly like every cell is not totally worn out. There are some cells which retain some of their capacity and they get into a state of dormancy. This dormancy requires what happens. See, if I give an example, a cell which is working 100% and a cell which is zero, in between we have got different cells which are in a state of dilapidated state, which are working at 30, which are working at 15, which are working at 8 levels, the capacity, the kind of thing. So if it is 100 at one point and 0 at the other end, in between you have got uh, some things like dilapidated cells which are not working to the full extent. They are not optimally working. So to repair that particular thing, insulin producing cells, this is one of the very good stuff, which is Gymnema sylvester, which is it can be used in late stage type 2 or incomplete type 1 diabetics also. And this is one thing which I believe can improve the kind of thing. And there are some things which we use which are helpful in kind of insulin resistance. We would normally use something like metformin or pioglitazone or something like rosiglitazone. I certainly try to avoid some things called sulfonylureas for some reason because they cause a lot of pancreatic stress, and that is my personal choice. I don't want my patients to be on sulfonylureas. Instead, I would like to go for the Gymnema sylvester and other stuffs. Bitter melon is one of the good stuff where to reduce the high blood sugars, which is we do usually get in our vegetables, modica charantia is the name which is called, and it is a bitter melon. Uh, so this is some other things what I can suggest about alternatives in this particular stuff is fenugreek seeds. Fenugreek seeds are basically to be given 25 to 100 milligrams daily, and there are a lot of compounds in that which can regulate blood sugars. You have got something like Jerusalem artichokes, a compound called inulin, which directly lowers sugars. This can be cooked as potatoes or something like, and artichokes. This is very important. So I was telling about something I was working on. Usually complications of diabetes and all that. The commonest diabetic complication which we are seeing nowadays is diabetic neuropathy. The manifestations clinically they present like something like numbness and tingling of extremities, which is a very common thing. The moment someone gets that, he gets tested for diabetes, and you have got something like loss of sensation, you have got loss of muscle control, You have got loss of bowel control. There is something like autonomic neuropathy, which we call. So he gets people have got something like dizziness. They have got autonomic dysfunction. They have some speech impairment. You have got some fasciculation. Sometimes you people get into something like restless leg tremors, or you have got some blepharospasms, and you have got automatic fasciculation. These are all the kind of clinical manifestations of diabetic neuropathy. So what I do, apart from whatever things have been conventionally given, I just to put them on something like alpha lipoic acid. I'm just opening up because this is not to be taken as a medical advice, but somewhere you should be aware of this particular stuff, because this is one thing which helps immensely. Alpha lipoic acid 100 to 100 or 150 to 300 milligrams per once or twice daily, it makes a difference. This is one of the rare thing acids. It's a water soluble as well as fat soluble antioxidant, which improves diabetic neuropathy. Sometimes clinically we go up to very high doses also. In few cases we have 1 up to 2 grams also. For other things which I would like to use for diabetic neuropathy is like vitamin B12 and vitamin B6. Vitamin B6 is about 40 milligrams twice or twice daily. Vitamin B12 we give it something like 1,000 micrograms per day. Usually it's in the oral form only. I'd like to prescribe something like a very simple thing called evening primrose oil, which has got something called gamma linolenic acid, which is very very effective. It is normally we give about 240 to 480 milligrams per day, and this is about. There are some other stuff which we normally do, which is omega 3 fatty acids. You use cod liver oil, fish oil, or flaxseed oil, or you can use ground flax powder seeds. That also is very very useful instead of trying to take into things. So this is how we try to work on that. There is another complication of diabetes, which is called retinopathy, where we use a lot of vitamin C with bioflavonoids. And apart from that, we try to use something like bioflavonoids. Usually, bilberry is an amazing thing, which is which is helps retinas of diabetes. You can say. I try to use one amino acid called L-taurine, which is 500 to 2,000 milligrams, which can be effectively used for people with visual decline in visual acuity or function as. So these are all the things which I prefer when I'm working with a thing called diabetes, and where simple. It's a very simple way of looking into how we can make a difference with this particular melody, and thing we need to look at this something called prevention, and this one is the key. Prevention as well as reversal of the disease is my way of looking into things, and I start with preventing, and my logo, which we have worked out on that, as well as my main theme of my work is trying to help people with chronic diseases, and yes, prevention and reversal of disease is certainly possible when we look into all these facets, and that is not a very tough thing. Right? We can always do some kind of diet, do some kind of exercises, what we are trying to talk about, and things will be much much easier. And so thanks for listening, and basically, if you have any kind of doubts and all that, or you want to have some kind of conversation, or you have some kind of medical advice, you can always call us on 98490 or you can log on to my website, drsaxenaclinic.com, drsaxenaclinic.com. Thank you.